Pregnancy is a time of joy and anticipation. Expecting parents often dream about the future, imagining the life they will build with their new baby. The excitement of feeling the first kicks, seeing the baby on an ultrasound, and preparing the nursery are moments filled with happiness. However, it's also a time to be aware of potential health risks. Understanding these risks can help ensure a healthier pregnancy and a safer delivery. One of the critical aspects to consider is the possibility of disease transmission from mother to child. One such risk is mother-to-child disease transmission. This is a process where a disease or infection is passed from a pregnant woman to her baby. It's important to understand how this transmission occurs to take preventive measures. This transmission can happen in several ways. During pregnancy, diseases can cross the placenta, the organ that nourishes the baby. The placenta acts as a lifeline, providing oxygen and nutrients, but it can also be a pathway for infections. This transmission can happen in a few ways. It can occur during pregnancy when the disease crosses the placenta. The placenta is a crucial organ that connects the mother to the baby, allowing for the exchange of nutrients and waste. It can happen during pregnancy. The placenta, while providing essential nutrients and oxygen to the baby, can also be a conduit for infections if the mother is carrying a disease. This is when the disease crosses the placenta. The placenta is a vital organ that supports the baby's development, but it can also be a route for disease transmission if the mother is infected. The placenta nourishes the baby. It provides oxygen and nutrients, but it can also be a pathway for infections. Understanding how the placenta works can help in taking preventive measures. Transmission can also happen during childbirth. As the baby passes through the birth canal, it can come into contact with the mother's blood and bodily fluids, which may carry infections. The baby comes into contact with the mother's blood and fluids. This contact can be a source of infection if the mother has a transmissible disease. It's crucial to be aware of this risk to take necessary precautions. Finally, some diseases can pass through breast milk. Breastfeeding is essential for the baby's nutrition and immune system, but it can also be a transmission route for certain infections. Understanding these risks is the first step in protecting both mother and baby. By being informed, parents can take proactive steps to minimize the chances of disease transmission. Knowing the risks helps parents make informed decisions about their health. It empowers them to seek appropriate medical advice and take preventive measures to ensure a healthy pregnancy and delivery. It also highlights the importance of early and regular prenatal care. Regular checkups can help detect and manage potential health issues, ensuring the well-being of both mother and baby. By staying informed and vigilant, parents can create a safe and healthy environment for their new arrival. Prenatal care is essential for a healthy pregnancy. It involves regular checkups with a healthcare provider. These checkups monitor the health of both mother and baby. A crucial part of prenatal care is screening for diseases. These screenings are tests that look for specific infections. Early detection is key. Early detection allows for timely treatment. This can prevent serious complications for the baby. These complications can include birth defects, developmental delays, and even death. HIV/AIDS is a serious condition that affects millions of people worldwide. It is a virus that targets and weakens the immune system, making it difficult for the body to fight off infections and diseases. The immune system is our body's defense mechanism, and when it is compromised, it can lead to severe health complications. If a pregnant woman has HIV, she can pass it to her baby during pregnancy, childbirth, or even through breastfeeding. This transmission from mother to child is known as vertical transmission. Vertical transmission is a significant concern, but the good news is that there are effective ways to prevent it. One of the most effective methods is the use of antiretroviral therapy, or ART. ART involves taking a combination of HIV medicines every day. These medications work to reduce the amount of HIV in the body to undetectable levels. By lowering the viral load, ART helps to protect the immune system and significantly reduces the risk of transmitting the virus to the baby. When a pregnant woman with HIV adheres to her ART regimen, the chances of her baby being born with HIV drop dramatically, often to less than 1%. In addition to ART, healthcare providers may recommend other preventive measures to further reduce the risk of transmission. These measures include avoiding breastfeeding, as HIV can be transmitted through breast milk. Another preventive strategy is opting for a C-section delivery, which can help minimize the baby's exposure to HIV during birth. By following these guidelines and working closely with healthcare providers, pregnant women with HIV can take significant steps to protect their health and the health of their babies. Syphilis is a sexually transmitted infection. If left untreated during pregnancy, it can have devastating effects on the baby. These effects can include premature birth, stillbirth, and organ damage. Fortunately, syphilis is easily treatable with antibiotics. Routine prenatal screening for syphilis is crucial. Early detection and treatment are essential. This protects the baby from the serious consequences of congenital syphilis. Section 5. Hepatitis B and C, Transmission Risks and Prevention. Hepatitis B and C are viral infections that affect the liver. Both can be transmitted from mother to baby during pregnancy or childbirth. Hepatitis B can also be passed through breast milk. Vaccination is available for hepatitis B. It is highly effective in preventing transmission. For babies born to mothers with hepatitis B, timely vaccination is crucial. There is currently no vaccine for hepatitis C. However, there are treatments that can help manage the infection. Section 6. Rubella, Zika, and CMV viral infections during pregnancy. Understanding these infections is crucial for expecting mothers to ensure the health and safety of their unborn children. Rubella, Zika virus, and cytomegalovirus, or CMV, are viral infections that can cause serious birth defects if contracted during pregnancy. These infections can have profound impacts on the development of the fetus, leading to lifelong challenges for the child. Rubella, also known as German measles, can lead to heart defects, hearing loss, and intellectual disabilities. It is particularly dangerous during the first trimester when the baby's organs are forming. Early detection and management are key to mitigating these risks. Zika virus can cause microcephaly, a condition where the baby's head is smaller than normal. This can result in severe developmental issues and requires ongoing medical care and support. Pregnant women in areas with Zika outbreaks should take extra precautions to avoid mosquito bites. CMV is a common virus that can cause hearing loss and developmental delays in babies. It is often spread through bodily fluids, and pregnant women should practice good hygiene to reduce the risk of infection. Regular prenatal checkups can help in early detection and intervention. Vaccination is the best protection against rubella. Pregnant women should ensure they are vaccinated before conception, as the vaccine is not recommended during pregnancy. This preemptive measure can significantly reduce the risk of rubella infection. For Zika and CMV, prevention involves avoiding exposure. Pregnant women should use mosquito repellent, wear long sleeves, and stay in places with air conditioning or window and door screens to keep mosquitoes outside. Avoiding crowded places and practicing good hygiene can also help prevent CMV infection. By taking these precautions, expecting mothers can protect themselves and their babies from these harmful viruses. Section 7. Toxoplasmosis, a silent risk for unborn babies. Toxoplasmosis is a parasitic infection that can be transmitted from mother to baby during pregnancy. Cats are common carriers of the parasite. Pregnant women can be infected through contact with cat feces. Toxoplasmosis can cause serious problems for the baby. These problems include vision loss, hearing loss, and intellectual disabilities. Pregnant women should avoid changing cat litter. They should wear gloves when gardening. These precautions can help prevent toxoplasmosis infection. Section 8. The power of prevention. Seeking early and regular care. Protecting the health of both mother and baby during pregnancy is paramount. Early and regular prenatal care is the cornerstone of this protection. Prenatal care includes screenings for various diseases. It also involves open communication with a healthcare provider. This communication allows for personalized advice and care. Remember, knowledge is power. By understanding the risks of mother-to-child disease transmission and taking preventive measures, we can work together to ensure healthy pregnancies and healthy babies.